There we go. What's up, world? Welcome, welcome, welcome. This is the Second Opinion Sports Medicine Podcast. Dustin, what's going on today?
Yes, sir. Not much. Ready to get this podcast going.
Nice. Yeah, well, we're at episode 25. It's your weekly dose of sports med ed, as I like to call
I
it.
like it.
I just made that up on the fly.
I know that was good. A little improv. I like it. That was good. It's gonna
But
stick.
it's a monumentous episode 25. It's the end of our season one. So
Yeah. Woo.
we try to chunk our
We did it.
episodes, our seasons in 25 episode seasons. And congratulations, man. I'm glad that we've been consistent with this and
Yeah.
I'm proud of you. Good job.
Yeah. That's huge, right? Discipline and consistency. And we were able to do that. We set out 25 weeks ago and we're here.
Yeah,
So
no, look, you're not good at anything right off the bat. Everything takes practice and repetition. And the best way to get better, I think, is to be consistent. And that's in weightlifting. It's in this skill set that we're trying to develop and anything else. And so I'm excited for the start of season 2 next week. A lot more in-office guests and interesting conversations, patient cases, things that we didn't necessarily get to in season 1. Yeah, so if I had some champagne or a beer, I'd cheers you right now. But next
pop
time we're
that.
in person, we'll do that for sure.
Sounds good. Sounds good. Tell Terry to get that on ice and get ready to celebrate.
Yeah, we'll have a little something at the neighbor's pizza spot
Yeah,
next door.
for sure.
Yeah.
Yeah, he's a
Well,
big sponsor of ours, so we gotta give him a shout out.
he keeps us going for sure.
Yeah.
Yeah. Man, how was the weekend? Everything good with you? What's good this week?
Everything good. I got in an accident yesterday morning.
Oh no.
Yeah, yeah. So that was kind of it is what it is, but I got we got T-boned pretty good on my way to my daughter's game, 6:40 in the morning.
Whoa.
I won't go into details because it's under investigation right now, but
Sure.
luckily, knock on wood, nobody got hurt. So, but kind of one of those scary moments, that you don't expect. That they call them accidents for a reason, and yeah, so scary. But knock on wood, everybody's okay. I'm a little banged up. That's why I was shooting for coming down to get treated by you, man.
Oh, I got you. Shoot.
That's why I was like, no, I'll come down. Like it doesn't matter if who.
Dude,
So
come down next week
yeah,
early
yeah,
and let's get you some body work in the
yeah,
office.
yeah.
I have a therapist who works Monday nights. We'll get you that last appointment. It finishes right before we record. And, you can do a jog around the block to wake up post
There
massage.
we go. Yeah, we'll make that work. But yeah. But yeah,
I'm scary to
so
hear.
that yeah, oh yeah, you keep reliving everything in your head, and it's just like the movies. Everything was slow motion and then fast motion. It was crazy. So
I don't want to go off tangent, but since you mentioned it this week, we had a car accident outside the office. I was
that's
actually in
right.
the office with a patient
Yeah.
and I didn't hear it, but I saw my front desk girl. My treatment room has a window that you can kind of see out into the lobby a little bit. And I saw Arlene, my office manager, kind of like it looked like she ran from one side of the reception room to the other. And I was like, I think she has to take an urgent call or something because she kind of went outside and I saw that erratic movement. And then the next time I look over, I see her and she's like, her face is telling me something's wrong. And so I tell my patient, hey, I'll be right back. I think something's going on. And I walk outside and she said, there was just an accident. I thought a fender bender, something. And somebody had ran that red light right on the corner there by the trolley, Dustin, and got T-boned, got shoved into the trolley tracks, missed the trolley, but jumped up on the curb. And I think I sent you a
Yeah,
picture.
you did.
The car ran and almost went through mine and my neighbors, mostly my neighbors, business. It would have
Yeah,
gone through the window, but they have a railing on their sidewalk, like
yeah,
a railing basically, right, for
yeah.
a patio seating.
Patio. Yeah.
And that car crunched that railing, but it saved it from going into the restaurant. So I get out there and there's a mother and a daughter. At first, I just thought there was two people. They were already out of the car. The woman had broken her nose. Apparently, that's what my first thought was.
Mhm.
She was bleeding. So right into emergency procedures. Hey, sit down. Like, don't move. I was concerned about the baby. I looked in the car. There was a car seat. I didn't help them out, so I don't know how they got to the sidewalk, really. And after a few minutes, without getting too detailed in the story, I look over and there was a gentleman in the car with him that was in the passenger seat where the impact had occurred. So
Mhm.
they got T-boned on the passenger side. And this guy was in shock. At first, I was like, man, he's not checking on his wife. She's hysterically crying. Her nose is bleeding. I had my patient actually got me some gloves from my office, got me a couple massage sheets for like a blanket. It was early in the morning, they were cold. What I noticed was the person in the car was in such a state of shock that he wasn't able to like help his wife or his girlfriend, whatever the
Mhm.
relationship was, or the kid. And at first I was kind of angry, like, man, what is this guy doing? Like, take off your sweatshirt, give it to the baby who's like half naked, or
Yeah.
check on your girl. Like, she's over here. But he was in shock. And I realized that after I assessed the baby, and the mom, the fire, and paramedics came and, kind of handed them off. And then I
Yeah.
said, "Hey, dude, are you okay?" He was holding on to his rib cage and suggested he go to the hospital. At first, he didn't want to. And I could tell by the look in his face, he was in shock at least. I don't want to speculate, but probably had a concussion. His arms were shaking when I gave him water. So I think my statement to you was, you never really know how you're going to react in an emergency. And we had this conversation earlier in the season, just it's fight, flight, or freeze is
Mhm.
what it seems like. And I'm reminded of it frequently again this last week. And I don't know, I've been thinking of different scenarios and like how I would react in those scenarios, just because I think if you don't think of those things beforehand, then you're left up to reaction, and
Yep.
there's no guarantee that thinking of it's going to help you respond any better, but I think it can't hurt,
Yeah.
you know?
Yeah. Yeah, really scary. And you sent that. One of our listeners is a patient of mine that listens regularly. Feels like he knows you, kind of thing. He calls you by name, and
Ah,
it's
that's
cool.
cool.
But
Yeah,
yeah, he's a first responder, and that morning we were talking about. He was asking me questions about your office, and I was talking to him about going down and everything. So we were just talking about the surroundings and
sure.
everything. And I had him on a passive modality, and I went outside to sit at my desk, and I checked for messages, and I saw your text,
Mm,
and it was crazy because me and him were just talking about how it was all set up, the street, everything. And
yeah,
then when we walked out, I said, "Hey,
let me
here's
show you this.
if you want to see what his office looks like. And by the way, here's," and
Yeah,
he's like, "Oh crap," because that's what he does for a living. He's, paramedic, he's with all them. So anyways, it just was a good, we were talking about the rail, how it saved
yeah.
the saved them, and how solid that rail was.
Man,
Um,
I always had a lot of respect for our first responders. Of course, my cousin's an EMT, and we have a lot of patients who are in all branches of first responders. But yeah, just having the paramedics and the firefighters arrive, and just that's an everyday thing for them, a motor vehicle accident, whether it's significant or not. But it's not every day a car runs into your office. And even though I've dealt with different emergency procedures, car accidents, been in them myself, I was a couple minutes away from getting coffee, and then I came in after that whole thing. We canceled a couple patients, and my office manager said to me, "You still need that coffee?" And I said, "No, I don't, I'm wide awake right now." Like it. Yeah, it's scary things. I'm glad you're okay, man. Who is it, if you don't mind? Leanne in the car with you,
Yeah,
your
Leanne was
daughter?
in the car, and
Yeah.
my youngest, Brianna, was in the passenger side,
Dude,
which took the impact. So that was the scary part. Yeah, but she's okay. We were on our way to the game, and she had to crawl out the other side because we couldn't open up the door.
dang,
And right when the police were showing up, one of her teammates' dad was walking down because we were literally right
just there.
at the parking lot. Yeah, we turned to get into the parking lot, and they came and got her, and she was able to walk away. And I asked the cop if she had to stick by, and he's all, "Well, is she driving?" I'm like, "No, I'm pointing to her. I'm like, "No, he's all, "No, she doesn't have to be here as long as she's okay." I'm like, "No, she seems okay." And then I was dealing with that for an hour or so. So by the time I got to her to check on her, she was already playing and feeling good. But
That's
still,
good.
all day long, I kept checking on her just to make sure, because we know
Yeah,
how,
you never know.
how you can feel fine, and then all of a sudden, it starts creeping up on you. And that's kind of what I didn't realize I had. But once the adrenaline starts wearing down, and once you start not even thinking about stuff, but you start feeling stuff, and then you
Yeah,
realize, this is what it was from. Yeah. So, but that's like we always talk to our patients about, right? If they get in car accident, a lot of them will be, "Oh, I'm fine, no big deal." And I always tell them, I said, "No," I said, "You got to get it checked out. You got to, because what we see is, could be a couple days, could be a couple weeks, it could be months
yeah,
later that you start having these headaches that you never had, and you don't even put two and two together that it could have been from the accident, right? Because we're just not thinking that. We think immediate cause and effect, but that's not how those accidents work, So
Yeah, not always. I had somebody come in this last week actually off an accident, and her comment was, it wasn't even that hard of a hit, and she's
yeah,
like, I feel terrible. And I said, well, break down what are the worst things for you, movements, time of day, etc. And she said, well, I felt good, for a couple weeks. And she's like, but then I went back to my regular workout class. I was busy with life, and one or two workouts later, like something's off. She's like, my back is locked up, my neck is starting on one side only, very particular area, and point tender is like a little marble in there. I'm like, see this thing? This wasn't here the last time you came in. So even though it doesn't cause pain, now I found it, I press it. You're like, whoa, that causes pain. And I was saying, look, you get jolted, right? Imagine somebody coming up behind you and just shaking you. Like that's going to jolt you. It's going to cause some
yeah,
hyperflexion. And so like you getting T-boned, that's not a natural impact,
right,
I'm glad you're okay in the sense
yeah,
of nothing broken, nothing,
right,
no blood loss, no hospitalization, anything like that. But those soft tissue injuries are real.
yep, yeah. So that's what's new. So what about
Yeah.
your weekend, man?
Sheesh. Well, on the what's good tip, it's good
Yeah,
that you're healthy and you're okay,
yes, sir.
and same with the accident that happened in front of my office. I had a patient actually, who was supposed to come in at 9 a.m. that morning. And I said, hey, can you come in a little bit later? I was running behind with some patients. And, she had just walked by there like a few minutes earlier. And then she came back and was like, whoa, what just happened here? And we were just saying, like, I was kind of joking, like, you're so athletic that if you would have seen it, you would have hopped
Oh,
out of the way,
yeah,
made some agile move and got out. But, anyways, I was thankful that it wasn't worse, that some person on the sidewalk didn't get hit. Or I think if something crazy happens, I'd like to, in a crowd of 10 people, I might want to be the one to be there if there's like something that needs to be handled.
mhm,
However, I was super thankful, man, that there wasn't like I didn't have to do like CPR on somebody, that there wasn't like a child head trauma, something that would have just been like, hey, these decisions that I make over the next few seconds could really determine a very serious outcome. And so,
correct.
you know, it made me want to brush up on some emergency procedure. Every time something like this happens, man, I'm like, gotta stay sharp.
Yeah,
So that's what's good. I'm thankful for that. And then on a happy tip, one of my good friends just had a baby daughter yesterday.
wow,
Today's
awesome.
the 20th. She was born on the 19th, 219, and but they were expecting, but I was also anxiously expecting her arrival at some point. So we were like early February, mid February,
Yeah,
end of February. When's this happening? And so I haven't met baby girl yet, but that's
very
it's
cool.
always good news when a friend's family grows.
Yes, for sure, very
So
cool. I say congrats to them. I don't know them,
yeah,
but congrats. It's a big time in people's lives. So,
yeah, it's his first daughter. He has two boys,
no,
third
there you go.
child, first daughter. And so I was like, man, you're officially a girl dad. I'm gonna have to get him some sort of girl dad
Yeah,
swag. I'm sure
for
he'll like
sure.
it.
Yep, for sure. I'll teach them
But
the handshake.
yeah, please do, please do. I'll introduce you to him. You'll meet him. He'll come onto the pod at some point.
Great.
Well, hey, let's talk about some sports med stuff, since I said we're sports med ed, right? Let's
Yes, I like it.
have a couple topical points. All-Star weekend, some basketball stuff. But I had a question from a patient of mine that I thought was so simple, and I was like, well, that's worth a discussion.
Yeah,
And her question to me was, what's the difference between flexibility and mobility? And I had an answer that I gave her at the moment, and I'm curious what you think of my response, and if you would add to it, or if you'd say, dude, that was totally wrong.
yeah, I'll let you know. No.
But well, what I said was, this particular individual is trying to get stronger and also increase flexibility, and was asking me different stretches for different body parts and movements, right? And so simply I said, well, flexibility is like the amount of range of motion of your muscles. So you could have tight hamstrings, for instance. You're going to do a hamstring stretch to increase the flexibility of that hamstring muscle. And mobility, I characterized more like joint movement. So
Mhm.
you could have a very flexible hamstring, but maybe a less than mobile hip, even though your hamstring is very flexible, or you could have a tight hip flexor or psoas, but a very mobile hip joint, perhaps, right? So that was kind of my distinction, but it's not something that I had paused and really thought about. And then I was thinking about it later, and I was like, well, I'm going to ask Dustin what his definition is of the two.
Yeah, no, good. I love it. Flexibility, mobility, we usually use them kind of hand in hand,
Right.
you when people are talking about, uh, we always hear, especially when parents bring in kids, what I hear all the time, oh, he's not flexible.
Right.
He's not flexible. Or a patient like in their 20s, 30s, 40s come into me and they're like, oh, I've never been flexible.
Hmm.
And I'm like, man, I hate that because I first ask them, well, what's your definition of flexible? Okay. And I
Yeah.
first ask them because they're defining it right there. And then they're saying they're not. And my second question is compared to who? Because they always say, I'm not flexible. Well, one, what do you define flexibility? And two, who are you comparing yourself to?
Good
And
point.
so right then they start saying, well, and they come up with all these different answers. And it always comes down, well, somebody else told me that I wasn't flexible. I'm
Hmm.
like, well, that's their opinion. Let's take a look. And so many times they're more flexible than they actually think or whatnot. But typically, by definition, flexibility is more of a passive thing, typically, and where mobility is more of an active thing,
All right.
in the clinical sense, right? So when we're looking at somebody's hamstring, we do a straight leg raise, maybe, right?
Mhm.
And it's a passive movement. So we take their leg, raise it up to see their passive mobility, right? Or their passive flexibility. And then typically when we want to see somebody's range of motion or their mobility, we have them actively move their shoulder, right? So that would be, mobility.
Good distinction.
How are they moving? Mobility, whereas flexibility is more of a passive, uh, fixed position, right? I'm going to
Right.
keep their arm up to their head, see how flexible that is. But if I have them actively do it, that's going to be how mobile are they? So
Yeah.
I like what you said. Yeah, we're checking the joint. I believe mobility is more of a joint kind of thing we're looking at. How movable are you?
Hmm.
And whereas the flexibility is more, I'm thinking more muscle, tendon insertion. I can tell you that a lot of my pro athletes, and I'm sure you're in the same boat, if we had them do just a simple touch your toes hamstring stretch, right? They would not have great flexibility or mobility in that range of motion. But when you get them doing what they do, they're unbelievable. And
Sure.
so we're not trying to change to get them to textbook. What we're trying to do is get their flexibility and their mobility equal both sides and maximize their full potential regardless of what the textbook says.
Correct. Yeah. Yeah, we
So
want them to be symmetrical and also sports specific, right? So for you in hoops or versus football versus pickleball, those are all different types of things that you may want to be explosive or have some increased range of motion, flexibility. There's some sport specific needs for different things.
correct. So our job's not to necessarily change those, you know, real early in my career, I was naive and I would try to, oh, we have to improve your flexibility, right? And it's like, really? Well, I've gotten to where I'm getting, where I'm at now based on my range of motion, my flexibility, the way it is.
Yeah.
So, I'm like, okay, yeah, true point. So let's just make sure it's healthy.
Right.
I don't care
No,
what
I
the
think
textbook says.
no, that's a good distinction. I had somebody this week who was saying, he's in his late 40s, and he was saying, "Gosh, I feel like I'm not as strong as I used to be." And I said, "Hey, I'm in that same age demographic with you, and you're right. Like when I was 30, I was lifting heavier. I don't think it's that I can't lift as heavy as I used to then, but it feels different. Maybe I need more recovery. Maybe if I lift as heavy, my joints or tendons get a little more sore than they used to." And so he's like, "Man, so is it just like I'm never going to be as strong as I was?" I said, "No, dude, you could be stronger than you used to be." But I would look at it like maybe as you get older, what's more important is keeping your flexibility or increasing your flexibility, maybe even, and maintaining your balance. Also a level of strength, but maintaining your balance requires a level of strength by definition.
Mhm.
But maybe the flexibility and the mobility are more important than if you can bench press 225 pounds, especially when you're in your 60s or 70s or 80s. Look, I still want to be strong, and I think that's repetitions and movements. But I don't know if when I'm 65, I need to be benching 225 still. I think maybe I can achieve the same strength gains or maintain the same strength by benching 135, right?
Correct.
So his comment was, "Wait, you mean I can increase my flexibility even though I'm getting older?" And I said, "Yeah, yeah, yeah. You can definitely continue to get stronger as you get older. I just was reminding him that it's a little more challenging
Right.
as you age." But I
Yeah.
said, "I don't think that's the case for flexibility unless you're at the stage of being so old and you never did any flexibility work, never did any stretching, and now your muscles, tendons, ligaments are just dehydrated like a dried up sponge." That's an
Right.
analogy I use often of hydration is like a wet sponge is very flexible. A dehydrated or dry sponge, you could tap that thing on the countertop and it's just hard, right? And so he was pleasantly surprised, like, dude, I'm going to work on it because
Yeah.
I can get halfway down my shins, but I used to be able to get my palms on the ground. And I
Yeah.
said, I bet if you practice that 3 times a day, just for a couple minutes, within a month's time, you'll be way closer to that goal.
Yeah.
So he was
I love
pleasantly surprised.
Right. I love those. I mean, those are sometimes those are very rewarding cases because you open their eyes to a whole new world. And a
Right.
lot of times, the first thing people want to do is they come in, and we both get these. I need to get stronger. I want to get stronger. And what I tell them is, I said, okay, perfect. I'm with you. But we don't earn the right to add weights to anything until you have the range of motion and the flexibility. I
Right.
said, so because if you start adding weights to a shortened down muscle fiber, you're just going to reinforce that shortened down muscle fiber and strengthen that, which will
Yes.
set you up for failure down the road. You will feel stronger, but only to a certain degree. I said, but if you just work on lengthening the tissue and increase your flexibility and mobility, by design, a tight muscle is a weak muscle. Just by increasing that flexibility and mobility, and then we retest your 1 rep max almost
Yes.
all the time, or whatever we want to do,
Mhm.
a way to test their strength. I can't tell you how many times, and you know this, people are stronger and they haven't even lifted a weight. They just worked on their flexibility first. They got their muscles to have full potential. Then they were actually able to lift that weight that they hadn't been able to, and they haven't even started their strength phase yet. And I'm
I
like,
like how
perfect.
you put that.
Now we can start our strength phase. And they're like, "What? I'm stronger now than I was, and I haven't even lifted weight." Exactly. Now you understand. Got
Yeah.
to keep that length first. So
That I like the way you put that full potential of the muscle. That's
mm,
so important. I think that key point that you hit is worth repeating. You don't earn the right to load those muscles until you have what how do you specifically put it? Full range of motion and proper flexibility?
correct. Yes,
Yeah,
exactly.
you're right. Because setting yourself up for injury or setting yourself up for asymmetrical patterns or I call it spastic growth when you have limited range of motion and you're loading it and you're loading it and
Yeah.
you're loading it. You're just cinching that down.
Yeah.
So it's not always about strength.
Right. And it to your point, you and I love you. I've used your analogy so many times, or your demonstration with the tying the string in a knot and
Oh
showing
yeah.
knots, the length.
Hmm.
That was beautiful. I've used that so many times. So thank you for that little
Of
nugget.
course. Yeah.
And people can see it, but I use that same to talk about knots and length of the tissue. But then also show them, okay, if we have this knot that has shortened down and we start adding load to it, what happens? And it makes the knot tighter. As far as now they're not looking at length, they're just looking at the knot. And so then it's a demonstration. Okay, so we're strengthening it, but what are we doing that? We're
Yeah.
making that tighter and tighter and tighter. We're reinforcing that knot. It's going to be harder down the road to then back that up once you've gained strength around it. So
100%.
then they're seeing that and they're like, oh, I don't want that. Okay, then let's make sure we get that knot out first. Now you have this length, and now let's start strengthening. And yeah, so it's really powerful stuff. And well, and that's part of the problem we see. Not all, but a lot of, especially in the past, physical therapy. Right, the
Mhm.
physical therapy model was Oh, you have low back pain, let's strengthen your glutes and hamstrings, right?
Yeah,
So they come in with low back pain, they automatically start strengthening, right? Without doing soft tissue, or they do a little dabble of soft tissue just to make the patient feel good and get the blood flowing, but not for on purpose, right? Not with a purpose in mind. And I'm not saying all, because there's a lot of great PTs, and now they have the doctorate PTs,
for
so
sure.
PT's come a long way. I'm talking about the old model that some people still fall into. I
Yeah,
hear it all the time, and that's where a lot of patients come and see us because they've done PT, they've done 12, 18, 36 visits. They got better after 12, stayed off, and then eventually got hurt again or strained again. And typically, what we explain, well, maybe it's because you strengthened over tissue that wasn't ready to be strengthened yet. And so, and
such an important point. Such
yeah.
an important point, and I think I've almost defaulted to, and tell me if you do the same or if I need to change my ways. But
Mhm.
as you were saying that, I realized I almost have defaulted to looking for the asymmetrical pattern before I do any strengthening at all. It's like patients come in, you have low back pain. It's like, okay, I'm almost assuming that there is something asymmetrical or there's something contracted and tight. And I got to tell you, man, it feels like 90% of the time there is. So it's like, okay, well, let me find where that is. Is it in the lumbar spine? Is it in the paraspinals? Is it the psoas? Is it the hamstrings? Is it,
Yeah.
something going on with the hip flexors and the IT band? Or is it a little bit of all the above, you know?
Right. And one step further, what I see a lot, and because I've but I check above and below just like you do. We always
Mhm.
talk. So let's just talk lumbosacral area or low
Sure.
back pain, generic low back pain. Well, most of the time, glutes, hamstrings, quads, hip flexors. That's where everybody wants to focus because that's the immediate and direct effect. I also always look above and I go to lats and traps. And a lot of times we'll have the pelvis rotated and
Mhm.
fixated into a position. And what I'll do before I even touch the bottom, I'll go up above T10 and above,
Mhm.
and I'll either just take a few passes with my hand, strip those muscles, just elongate them, or I'll take the percussor, hit some trigger points on lats, traps over by triceps and the rotators, and then I'll recheck the alignment. A lot of times the pelvis will settle in just from
Just from that.
taking from up above, and I stay way away from the lumbar, T10 and up.
Yeah,
And then if it changes, I tell the patients before, hey, we're just going to check this. If it does make a difference, then we know most of your tension down below is coming from your upper body. If it doesn't change, then great. We know it's mostly coming from your pelvis. So we're not trying to do smoke and mirrors or be like a used car salesman
sure.
convincing. I'm just trying to figure out where's it coming more from,
Yeah.
upper, lower. We're still going to treat both, but
What's the
and
focus
it
point?
really, so that way we can give them homework too. So when I'm giving them a lat and trap stretch, they're not wondering, going, "There's nothing wrong with my neck and upper back. Why are you doing this?" Now
Sure.
they can see. Or I'll just go, we go right to the adjustment after they've been, not for new patients, but once they understand that, they come in with some rotational. I'll clear out the mid back, adjust the mid back, and sure enough, pelvis settles in. I'm like, perfect. We don't have to necessarily even adjust now. We could do more soft tissue down here than actual adjustment.
Right.
So
Yeah,
don't put
sometimes
more
that brings
mobility into a joint that doesn't need it.
yeah.
So
Yeah, it's not about, and I explain that to new patients often actually is at least I'm not attempting to adjust every joint in your body or every part of your spine. I want to adjust only the part of your spine that's restricted and has lack of motion.
right.
And that's the area that I'm adjusting, right? And so, yeah, it's interesting because sometimes I've had people come in and I just do soft tissue and we don't even adjust. It's like,
Mhm.
well, you're so wound up, like I can't even fight through how tight it is. And I don't want to force any adjustment by using extra speed or extra power. There's no need for that.
Yeah, right.
You're so wound up muscularly, like let's chop away at that. And then maybe next visit we can get an adjustment. And or if we get a little baby adjustment or a subtle correction, it's like, okay, that's improvement. We're going to build on that. We don't have to get it all today.
Yeah. Well,
um,
and that's what separates us too. We went to Palmer. Palmer is very, very specific, Gonstead Palmer type method, find it, fix it, leave it alone.
mhm.
So that's how we treat things. We are chiropractors. Even though we do a lot of sports med and if Palmer was still right, we'd be considered mixers because we use,
Yeah,
other
I guess
modalities and
so.
stuff. But from the purest chiropractic standpoint, I was just telling one of my patients today or the other day, you know, let's not forget the power of the adjustment. I'm the
Yeah,
brain sending a signal down, the spinal cord sending it out to all the different tissues. I have to locate these interferences to allow everything to function at its maximum potential. So that's what we're doing,
yeah,
and I might not talk about it much, but that's what I'm doing. And, whether they know what we're doing or not, that's what we're doing. We're getting the full nerve flow. So when we do release the hamstring, when we do activate the glute, it can do it fully versus just partially or hope to get the job done.
hope to
So
get it done,
there's a
right.
lot of power in removing that. It's like taking your foot off the hose. We've used that
Yeah,
analogy forever in our
yeah, yeah,
profession, but it's so true. We want that full nerve flow going to whatever tissue it's going to go. So
absolutely. Yeah,
yeah.
anyone who's really had I'll generalize it, a kink in your neck or any sort of nerve impingement, and then have that able to be released, and then they
Mhm.
achieved relief from that release.
Yeah.
They, obviously understand like, hey, there's something to what we do, or what we can do when somebody comes in with a spinal issue that's musculoskeletal in nature that we, can improve by adjustment.
Mhm.
So,
Agreed.
yeah, and that's part of the reason I'm excited for season 2 as well. Is I really like talking about some of these patient cases that come into my office, and I like hearing about the patient cases that come into your office, and just have a discussion about, hey, how did you treat this person? What was your thought process? Because not everyone who comes in has just neck pain or back pain. And there's some pretty interesting outcomes that I've had over the years that are worth talking about and sharing. Not everything is right down the middle. And when you talked about mixers, I was kind of thinking to myself, I think everyone who's involved in medicine should be a little bit of a mixer.
Mhm.
That's my opinion. I think that's one of the problems that we have is people get so stuck in their lane and thinking that their way is the only way. Or there's nothing wrong with being in your lane and being great at what you do, but also knowing what other people do and how to work with them as a team. I mean, I think that's so important. And I hope we see more of that, where there's more collaboration between PTs and chiros and MDs and orthopedists. And I know you have a team of people, I have a team of people and people we work with, and there's no animosity, there's no
No.
ego. I think when you work with people who are great at what they do, it's like you recognize, man, that guy is a stud at what he does, or that woman is one of the best at what she does. And, I think we're some of the best at what we do, and we continue to learn. So, if somebody wants to catch up, they got to put in 23 years of
Yeah.
daily effort and grind to get to where we're at,
Yeah.
and
Mhm.
experience. And so I'm excited to talk about those cases in season 2, talk more about some patient cases and some cool outcomes, and then get your opinion as well on like, hey man, why did you think that worked? And had you seen that in the past? And,
Yeah.
kind of chop it up a little bit. I'm excited for that because I don't get to do that very often.
No, for sure. Me too.
Question for you, if I can switch gears. Did you catch any hoops over the All-Star weekend?
I didn't catch any. I caught highlights. It was all over social media. The
Hmm.
slam dunk contest that was exciting.
Yep.
Just because of who was involved and who won. So, did you catch any of that backstory?
I happened to go to dinner with Kelsey on Saturday night. It was, yeah, Saturday night or Sunday night. When was this? Honestly, the last week of my days have been meshing together. But I went to dinner with Kelsey. It was on in the background, and I got to catch the dunk contest and saw Mac McClung, infamous now Mac McClung, win the
Yeah,
dunk contest. And I really like his whole backstory, and how he seemingly came out of nowhere to now becoming a little bit more of a household name. I think that's awesome.
yeah, for sure. I'm trying to look it up.
Can I
Did
give you
you?
some insight on him real quick?
Yeah, give me a little background, but
Okay.
because there was a good quote from. Go ahead.
Yeah, you can look that up while I tell you a little bit about him.
Yeah.
So he's on the 76ers officially, the 70s, Philadelphia 76ers. He signed a 10-day contract. He'd actually only played in 2 NBA games ever before this slam dunk contest.
Isn't
And
it crazy?
to be honest, his 2 NBA games weren't even this season. They were last year. He played one
Jeez.
game for the Lakers and then one game for another team. But yeah, I thought that was interesting. And in the dunk contest, he was 4 for 4 in the dunk contest. Three of his dunks were a perfect score. So
Dang.
that's pretty amazing. Three out of his four dunks were 50s, which is a perfect score. And one of his dunks, when you're in a restaurant that it's on in the background, it's usually
Yeah.
muted. So I was like kind of reading the captions and watching it. But on one of his dunks, he puts on this tight uniform over his uniform, and I'm like, what is that? It said like Gate City or something. And I'm like, Gate
Mhm.
City, that must be his college or his turns out it's his high school, which is why it
That's
was so tight. He put on his high school
high
jersey.
school.
I think that's
That's
awesome.
awesome. Yeah.
Yeah, he gave his high school some love on national television.
So
And
cool.
then while he was wearing that high school jersey, he banged out a 50 dunk.
That's awesome.
And so I think that might have been the game winner, the one that he did with the high school jersey on. But he went to Gate City High School in Virginia. He had actually become an internet sensation kind of when he was back in high school for being a dunker. He's
Okay.
uh, kind of a dynamic, explosive guy. And so he had a following. And what I thought was interesting too on a 2023 tip, he has two or three times the followers that the other three contestants had
Yeah.
individually. So I think he has like 800,000 followers. Maybe some of the other contestants had 100 or 200,000 followers, or maybe a quarter million.
Yeah.
And they're like, who's this guy who's never been in the NBA with 800,000 followers? Well, it's because he had developed a little bit of internet fame back in the day from some dunks in
Yeah.
college and high
That's
school.
cool.
So yeah, he went to Georgetown for a while, and then he was playing for Patrick Ewing in Georgetown, and then he transferred to Texas Tech and entered the NBA draft twice. Actually, the first time he entered was I think after a second year at Georgetown, and then he pulled out, transferred to Texas Tech, re-entered the draft, got picked up by a couple teams, released, and now he's on the Sixers on a 10-day. And lastly, yeah, he won $100,000 being the slam dunk
Oh man,
champion, which is something like a multiple of what he's made in the NBA total.
that's funny.
So I
That's
thought that
awesome.
was cool. And one night, this guy, a week ago, he was playing in the D League,
Mhm.
and then he signs like a 10-day contract so he can do the dunk contest with Philly. And also now he has a sponsorship. I think Puma picked him up.
Yeah, I
Um,
saw that.
there's a couple other fortuitous things that happened for him. So man, I love that. I love that people's fortunes can change in a day or a
Yeah,
week or a month, quickly.
yeah,
And I don't know the young man. I don't even know if he's a good hooper. Maybe he doesn't even make the rest of the season on a team, but pretty cool.
yeah. He got his moment for sure, which was awesome, and he capitalized on it. I watching the highlights. He had a. It looked like he had a blast, and he he did not do easy things to get to there to get to that point. I mean, they're
Dude,
unbelievable. I mean, to see what
unbelievable.
he was doing,
Yeah.
it was funny how he set up one of them. The two guys were standing there like he was going to jump over both of them, and then
Yeah.
he came up to him, got him up, put him on his shoulder, put the ball, and that was pretty cool. Like a little showmanship. But yeah, he was good. The quote I was looking for, I saw the interview, but Shaq pulled him aside before, and you might have seen it on. It's all over, but
Mm-mm.
Shaq basically leaned into him and said, "Nobody knows your name. Make them remember your name, and don't miss a dunk." And then all Max said was, "I got you." And then he does that,
That's
But
very cool.
how true is that? Like for Shaq to actually say that, "Hey, nobody knows who you are.
Yeah.
This is your moment."
Yes.
So that's so cool. Such a good story, and it'll be definitely a TV movie at some point. A little
Very cool.
documentary, docu series. I think be a good one. But yeah, good
Yeah,
for
I
him.
love stuff like that, whether it's that or whether it's, I saw a college kid who put a golf ball on the basketball court the whole length of the court and basically had to make it into this small hole, like a mouse hole, like the size
Yeah.
of a cup on the other side of the court. And it was for a new car, and he put it and it was going, and the announcer made it really nice. He's like, no, it's not. No, it's not. Like,
Yeah.
oh my. And then it went in, and he lost his mind, as a college kid would if you win a car. And dude, moments like that are cool. I love
Yeah,
sports because of that.
that's fun. I saw a little kid, he must have been junior high or something. he had to hit like three different stages, and then the last stage was from half court.
Oh, I
So
saw that.
yeah, he hit $10,000. He hit it.
Dude.
Everybody went crazy, and this little kid, like, he had to hit each mark, and he just it was
Well, he
fun,
was
man.
4 for 4. He didn't even miss one.
Yeah, 4 for 4.
I
Crazy,
told
right?
I told my cousin I'd give him $200 and I'd give him double the time, and I was like, "You still couldn't do that." He's like, "Oh, the layup and the free throw would be okay." And I was like, "Dude, you wouldn't even go what are you talking about? That kid did something special." You
Yeah,
know?
big time. And it was just his moment. Everybody went crazy. That's fun, man. That's good human stuff, you know?
I can't say this for sure, but I'd be willing to bet that that moment for that young kid leads to him being more confident, leads to him just I don't know, man, maybe even believing in himself more or just having like that's going to leave an imprint on him. And even as he gets older, he's gonna be like, yo, I did something amazing when I was
Yeah,
young.
right.
And I think there's a little seed that gets planted in you. Once you do something extraordinary, you know that you always can do something extraordinary.
It makes it possible, right? I
Makes it
believe that.
possible.
That's those fork in the roads. We have these fork in the roads all the time,
Hmm.
you know, and we have a blueprint that's in our mind too, and these fork in the roads. So it's pretty cool, you know. Yeah,
Yeah.
I agree. It's hard to believe that it wouldn't have some kind of impact.
Yeah, for sure. I mean, I think if we both spent 5 minutes and said, hey, let's go decade by decade in our lives and pick out 2 or 3 moments that were shape worthy, positive or negative, we'd probably be able to pick a few out.
Yeah.
I think in the decade I spent in school, with you, a half a decade in Cairo school,
Mhm.
look, a couple of those moments might have been exams where I was under pressure and had to perform, but some of that might have been just some silly football victories I had with you guys.
Yeah,
I
for
mean,
sure.
those were some memorable moments. And unfortunately, I remember some interceptions more than I remember some of our victories. But I do remember a lot of those trips and
Yeah.
plane rides and hotel rooms and all that stuff. And
Yeah.
it's the funny things. I appreciate that we got to have those times out of the classroom.
Yeah, for sure. Those were good memories. We'll definitely have to dig out some pictures and photos and sit down over some dinner and go over them.
Yeah, dude. My wife doesn't believe that I used to be able to ball out.
Yeah. Dust off some old. I think I still have my jerseys.
Yeah.
Yeah.
Yeah. Somewhere. I think I have mine too. They're probably packed away in a box. In fact, I have a Tupperware kind of container in the garage. And when I moved out of my last place to here, I found like 7 of our footballs, 6, 5, 6, 7 of our footballs, and a couple of them from our championship ones where we signed them. It's
Yeah. Oh
ink's all
man.
faded,
Yeah.
but I've been meaning to pull that out, pump it up, and bring it in to one of our in office just so you could feel it again.
Yeah. That's cool.
I still got the imprints from throwing it, like where my thumb and fingers go. So yeah,
That
I'll have to
mud
bring
bowl we
that.
played in Davenport, that mud bowl
Yeah,
was muddy, and I remember, oh, that was a crazy championship game.
that was a good time. We were just young and in school, and it set the
Yeah,
tone for the next years to come.
for sure.
Yeah, it was fun, man. Well, I have a few patient cases I'd like to talk about with you next week. Um, I wanted to bring up one thing and then ask you if you had anything that was on your mind. I saw an interesting article this week, and it said that people are now planning to have a 60-year career, whereas before, maybe our parents' generation, it was like a 40-year career. And so it made me think of why is that? And basically, the article said, well, people are living longer. And, if you don't have enough money in retirement, maybe working till 65 or 60 isn't going to, your retirement's not going to carry you to living to be not to be 90 years old. And so they were saying people are having 60-year careers, maybe working from 20 to 80 because they live to be into their 90s type of situation. So it made me feel a couple type of ways. One is I'll always be in the medical field in some way, shape, or form, but I don't know if somebody has to do something for 60 years. I think you could be a great doctor for 20 years, be a great podcaster for 20 years, be a great teacher for 20 years. I don't think that all has to be like, hey, I work construction for my whole life and that's all I do. So I only say that to make people think about starting the process of becoming great at something else. You know, our job is our identity often, right? And so why can't we be good at more than one thing or have more than one job in a lifetime? So that was a thought I had. And, you know, if you're having a 60-year career, it means we're living longer. So, you know, it makes us tying it back to sports medicine. Well, how do we want to live? What kind of quality of life do we want to have as we age? And I don't know if you can make those changes when you're 70. I think you have to start that process when you're much younger, you know?
Yeah.
What do you think about that, the 60-year career? Had you heard of that? I just read that just literally today.
No, I hadn't heard about that, but I kind of, as soon as you start saying it, my first impression, especially being here in California, we're seeing it all over. We're seeing 70, 80-year-old pizza delivery people, right?
Yeah,
And people, 70s and 80s working, gas station jobs. And it's unfortunate because it's not because they want to, it's because out of necessity,
necessity.
to live, at least in California, it's too bad. And I'm sure other parts of the country, it's just equally, necessary to survive. They need to work longer. But I think it's sad, right?
Yeah,
Um, that's the reason behind that kind of number. But I like what you're saying. I fully believe that there I I want to evolve, right? I want to evolve, and that means in my career in whatever I'm doing. I know my purpose is to help people, and I
sure.
feel like I haven't even reached my full potential of helping as many people as I can. I have
Mhm.
my immediate nucleus, but that's one of the reasons we started this podcast was to hopefully set up a platform to reach even more people outside of our clinics, right?
Right.
So right now, most of the people listening are within our clinics, hopefully they tell one of their friends, and now we get somebody else that we don't even know
Yep.
listening, and that person tells 10 and that person tells 10. That's how it's going to organically grow. And then we're talking to people that have never met us, have never been in our immediate influence. And then hopefully, like we talked about, both of us want to continue to figure out how to do this and reach more people,
Yep.
just like our, predecessors did through when, before there was TV, there was radio. And, the chiropractors figured out, hey, we need to reach out to more people. So they got on the radio and they started telling chiropractic stories. And then when television became, then they got out to more people. It's all about how can we reach. Well, our day right now is podcasts. There's going to be another media,
Yep.
that we have to. So I
Yeah,
want to
another
evolve.
platform.
Yeah, and I know, no matter how we can do it, helping people is what we're here for, and I wanna continue to do that, and I love what we're doing, and so I'm with
Likewise.
that. Regardless of what it looks like, whether it's wearing the chiropractic hat, the podcaster hat, the educator hat, so
All of it. Yeah, look, there's one thing that I know about you since I met you 23 years ago, January of 2000,
yeah.
that everything that you've done, you've gotten better at, right?
Mm,
And I feel like there's a lot of things in my life that I started out as being the last and that ended up being first or close
yeah,
to first. And so we'll continue this too. Look, we're going into season two next week. And I promise you, season two is going to be better than season one as far as content, interviews, quality of presentation, all the above. And so,
right.
yeah, I'm excited for our next season. I'm excited for our kind of journey through this whole adventure of podcasting and seeing what's next, But the 60-year career article made me think, well, I want to be great at multiple things, and I know you do too. But yeah, I thought it was interesting that I read that today. I wanted to bring that up with you.
Yeah. I like it. Well, they always say, it's not work if you enjoy doing it. Well,
Right.
we need to stay on that task of still enjoying it, you're right? Not
100%.
letting the BS of the other parts get us down, right? We need to stay one step ahead and stay fluid, like Bruce Lee says. We got to be like
That's it.
water. Stay
Yeah.
fluid, right? Work
Yep.
around the barriers or the hindrances and keep moving forward though. And that's what I think we're doing.
Yeah.
But by no means are we perfect, and we continue to grow and learn as we do this, right? So,
100%. And nobody that I know that's really great achieved that greatness with a straight downward, easy momentum path. It's
Right.
uphill. There's some, obstacles, and whether it's with this or whether it's, in anybody who's listening in their normal life, like that's just the journey of it, is to continue to learn and adapt and get better at it. Which
Correct.
I appreciate having a teammate as we do this together. It's a little more fun and a little easier that way.
Yes, sir.
Yeah.
Me too. Vice versa.
Well, hey man, we're kind of coming up, approaching the mark here. So, like I said, if you're okay with it, I'd like to carve out some time next week to talk about a patient of mine who broke his ankle. I'd like to talk about a patient of mine who had about a 9-month care routine. I thought it was an interesting where he started and where he's at today. I wanted to break that down with you and kind of get your opinion on that. So we can save that stuff for next week. Is there anything else on your mind for this week?
No, I have a couple cases that I'll run by you too, and then we can and make that a kind of a core part of it and go from
Awesome.
there.
Good. Well, to our listeners, thank you. One request: if you're listening to us, I know I can listen to us by just clicking on Spotify or Apple, but it does help us if you download the episode. So if you're listening to this, it is now the end of the episode. But if you can download it, subsequent episodes, if you can download that, those metrics help us as we grow. If you enjoy us, tell a friend. As always, you can find us on Spotify, on Apple Podcasts. You can also download us on YouTube. We appreciate you guys. Dustin, I appreciate the time, the insight, the knowledge, the jokes,
Mhm.
all the above. To all our listeners, stay safe for the week, stay healthy, and Dustin, have a good night, man. Give the family my best, and let's chat later on the week, and we'll do this next week again.
Sounds good. Looking forward to it.
All
Have a
right, my
good one.
brother. Well, I'm excited for next week. We have some good topics, and I'll chat with you later on the week. We'll catch up soon.
Sounds good, buddy.
All
Have a
right,
good
bud.
night.
Have a good night, man.
You
Bye.
too, brother.